So today we're going to discuss trauma in children. We've discussed this topic in a lot of different ways, little bits and pieces here, but today we're going to specifically look at it, and we're going to look at the physiology and the way that it applies to the brain as well. Okay, so what is psychological trauma? Psychological trauma is a distressing event experienced by an individual that is beyond that individual's ability to cope with or process. Trauma is an emotional response to a terrible event, like an accident, rape, or natural disaster. Immediately after the event, shock and denial are typical. Longer-term reactions include unpredictable emotions, flashbacks, strained relationships, even physical symptoms like headache or nausea. So one of the things I really want us to take away from here is that it's a distressing event experienced by an individual that's beyond that individual's ability to cope with the process. So meaning this is very subjective. What is trauma? It's psychological trauma, not physical trauma would be like a broken leg or something that's physical, that's objective. But psychological trauma can be very subjective. In the sense, right, it needs to be distressing, and it needs to be to the individual, and it needs to be on their ability to cope with a process. So it doesn't necessarily mean to be beyond everybody's ability to cope with a process. It's just beyond that individual's ability. So this is a picture of trauma. This is just an example of trauma. See how it's a house, and this is a house in bad condition. This house is in bad shape. But if you needed to, it looks like maybe you could hang out here and have a little bit of shelter from the rain, maybe a little bit. Right? It's absolutely in bad shape. You know, it might not need to be torn down. Maybe it will, but it can provide you maybe a little bit of shelter for a little while if you needed to. And this is complex trauma. This is kind of how I think of complex trauma. Complex trauma, not only is there really no house, like, okay, technically you have like part of a roof right here, but really there's no house. And before you could even rebuild, you have to pull all this debris away. So complex trauma is just a lot more difficult to deal with because it involves multiple different trauma. It involves multiple different fractions, and it usually involves a lot of different factors. It involves a lot of different symptoms, a lot of different causes. Complex trauma is a lot more difficult to deal with, and typically the consequences are a lot more debilitating to the individual who's experienced it, and it's taken place over a longer period of time. Okay, so trauma is a normal part of life, but you can have non-normal trauma. So trauma in general is not unexpected, right? We all should expect to go through periods in our lives where we're up against something that we can't handle or cope with or process. Typically, what most people will be able to do is they'll be able to reach out to a friend to lean on for a while. They'll be able to take a good nap. They'll be able to read a self-help book or something like that. They'll be able to cope with it eventually, or find the tools to help them cope with it. So trauma in and of itself is not abnormal. We all at some time will experience some level of trauma. However, there are non-normal trauma effects. So non-normal trauma effects would be effects from trauma that are not normal, such as becoming hypervigilant and not being able to sleep, such as having a racing heart at the drop of a hat. Those are things that are non-normal. Trauma happens to everyone, right, but doesn't always have non-normal effects. So some specific traumatic events like rape or severe neglect, etc., are not a normal part of life. So for example, if a 5-year-old pees his pants, well, that's not too abnormal for a 5-year-old to pee his pants. So it might be considered abnormal. It might be considered beyond the ability to cope with or process. For one 5-year-old, he's very embarrassed, and so it's beyond his ability to cope with the process. So maybe he has nightmares and doesn't want to go to school for a few days. So for him, he experienced it as a traumatic event. And then he eventually gets over that, gets over his nightmares, and is able to go to school. The effects that he experienced from the trauma of peeing his pants were normal. Those are kind of the effects we would expect for somebody experiencing that age, experiencing that level of trauma. That's kind of what we would expect. So the effects are normal. There could be another 5-year-old who pees his pants. He doesn't really care. He's not bothered by it. He's like, whatever, I peed my pants, whatever. So it's not experienced as a trauma by him. And then we can have another 5-year-old who pees his pants, and it is experienced as a trauma by him. He has nightmares. He refuses to go to school. He then will not allow himself to be out of underpants for more than like a split second. So going to the bathroom has become very bad. He's afraid of drinking any liquid because he doesn't want to pee. He doesn't want to be around peers anymore at all. He refuses to go back to the playground that he was at when he peed. These effects last for months. So those are non-normal effects. It was a normal trauma, a 5-year-old peeing themselves and it being beyond their ability. That's not that abnormal. But the effects are now, they have reached the non-normal stage. Coping healing from trauma typically happens with healthy, positive interpersonal relationships, right? We can see this backed up in many stories when we look at Bruce Perry's The Boy Who Raised a Dog specifically. When healthy, positive interpersonal relationships are not present, or when trauma is severe and non-normal, long-term or severe difficulties can arise. Yeah, so this is one of the reasons that early intervention can be very helpful, because relationships and those interventions that happen early on stop the damage from compounding over a lifetime. Healthy relationships provide a framework to deal with and work through trauma, and again, healthy needs to be in there because negative relationships can just increase the trauma. So, if you haven't looked at ACEs, I would encourage you to. ACEs stands for Adverse Childhood Experiences. I won't go over all of this, but this is just a picture of some of the things that the research has found. People who experience trauma are more likely to experience many, many things. This is just a smattering of the things they're more likely to experience in their lifetime. Common symptoms of unresolved trauma. These are things that we commonly see. Hyperarousal, guilt, withdrawing from others, dissociation, mood swings, triggers, and physiological symptoms such as insomnia or fatigue. So again, hyperarousal is that they're always on. They're always looking. They're always, what's going on? What's going on? I can't turn it off. This is kind of classic. We think of people coming back from wars with this, right? Guilt of maybe they're the ones who survived, or maybe why do I have it so good? Withdrawing from others, and again, it's very sad that withdrawing from others is very, very common of unresolved trauma because again, what's one of the big things they need to heal? Connection with others, right? Disassociation, so this is a disconnection between what your body and your brain. You're feeling like things are happening to somebody else. Mood swings, we would say labile mood, clinically speaking. So 1 second being super happy, the next second, just crying into their soup. Triggers, so again, when I use triggers here, I don't mean kind of the way they're just being used nowadays, anything that people don't like, they're calling triggers. That's not how we use the term psychologically. When we're talking about triggers psychologically, what we're really meaning is that triggers are something that are very closely connected to a trauma in an individual's brain, such that when that thing happens, it fires off the trauma or an associated event to the trauma. Triggers are something that should not necessarily be 100% avoided for people that have trauma. One of the things, in fact, they'll do with their treatment is to be able to get used to those triggers. Because if they can only live a normal life when everybody avoids doing all these normal things around them because they could be triggers, well, that's not them leading a normal life anymore. So there's a lot of talk about triggers and trigger avoidance and trigger warnings and all these things. It's important to keep in mind that's not how it's being talked about professionally in psychological circles. It means something much more specific in psychological circles, and it's not even something that should always be avoided, or maybe not even mostly avoided in psychological circles. I think the most important thing to understand about triggers is just to understand them and to recognize that people who genuinely have suffered trauma and have those genuine psychological triggers, just to understand what's going on with them if they are triggered. Not necessarily to seek to always avoid those triggers, but just to understand what's happening with them if they do get triggered. Okay, so we're talking a little bit about the brain and trauma in the brain. Right, so we've talked about brain development, right? We looked at brain development over looking at a child's life. So a few of the parts of the brain. So the left hemisphere, generally this is how it's broken down. We've seen some differences in things, but generally this is how it's localized. The left hemisphere connects motor, but on the right it's the opposite hemisphere. Language, memory creation, detail, sequence, logical thought based on language. Right hemisphere motor, again, cross, right, so it would be the left. Emotional processing, memory retrieval, spatial manipulation, facial recognition, and holistic perception, or like getting the gist of something, right? Getting like the big picture kind of understanding of something. These are the hemispheres that these things typically So for brain structures, looking at how trauma specifically affects a child's brain. Child's stress response is exaggerated and prolonged, resulting in changes to the child's brain organs, right? Because the stress response actually sends your body to do certain things, sends your brain to do certain things. However, if your stress response, especially if it's prolonged, it's going to have long-term consequences, especially if that's how the brain is developing, right? In the brain of a child, and so the brain is developing with these long-term trauma things, long-term trauma consequences happening to the brain. An individual that's an adult, like had a happy, healthy, successful childhood, and they're an adult and they undergo long-term trauma, absolutely that can be damaging to their brain as well. But it's much more damaging to a child's brain, because that is also as their brain is developing. So it doesn't mean they have a nice, fully formed, healthy brain to start with, and then damage is being done to it. No, what it means is that they don't even have that nice, fully formed, wonderful brain. As it's being developed in a way that is already damaged. So they can have a larger, more active amygdala, a smaller hippocampus, smaller and less active frontal lobes, and a smaller corpus callosum. So what we're going to do is we're going to look at these different organs and see the consequences of these things changing. So again, larger, more active amygdala, smaller hippocampus, smaller, less active frontal lobe, and smaller corpus callosum. Let's look at the consequences of that. Okay, so frontal lobe functions are impulse control, organization, time orientation, and reading social cues. There's more. These are just some of the big ones. So, what if they have problems with their frontal lobe, accessing their frontal lobes? Well, it means we're going to probably see these things, right? Problems with these things. Corpus callosum, so that's like the connection, the nerves between both hemispheres, having information go back and forth. So if they have a less active corpus callosum, it's not going to be well integrated. So the hemispheres won't be well integrated. So they're going to have problems using words to solve problems. That's just one of the things. But again, remember those two hemispheres and what they both do, and they both have different skills that are localized more in one hemisphere than the other. So imagine if a corpus callosum is less active, that means communication across those hemispheres is going to be less active and sluggish and slow and not as seamless as it would for somebody who has a nice, healthy, active corpus callosum. And then the amygdala, right? The amygdala is going to be bigger and more active in somebody who is experiencing long-term trauma, has experienced long-term trauma. So they're going to have a bigger and more active amygdala. So they're going to have problems with emotional control, delays in cause and effect thinking, difficulty with empathy, inability to describe their own emotions, hyperarousal anxiety. Because again, their amygdala, which controls our fight and flight and freeze, their amygdala is always on. It's always ready. It's always kind of going. And that is a very difficult state to live in. That means they're always living in the state of, okay, let's go, okay, right? And that's where they're living. And they're living there while they're trying to take a math test or learn what 2 + 2 is. And imagine if you were having to study for chemistry while you were running for a bear, right? That's kind of what it's like for their brain, right? It's like, what's your brain going to do? If you're running from a bear and studying chemistry, what are you going to do? You're going to get rid of the chemistry book, right? You're going to be like, I'm focusing on running from this bear. Thank you very much. Psh, who cares about chemistry right now? So if you have a really active amygdala, but you're also trying to do these normal things and learn and grow and develop, that is hard. That is very hard. Because you really need to quiet your amygdala down first before your brain even feels like it's a good idea to focus on anything else. Okay, so remember we also have the hippocampus. So the hippocampus, which is where memories are formed. So the hippocampus is going to be smaller, right? So what are some things we see? So we see impaired learning, right? There's less ability to make memories and learn, less ability to retrieve memories and recall things that have happened. They're more impulsive. Abused children often struggle with complex goal-directed behavior, have trouble adapting to transition, changes, and demands. And again, their frontal lobe is not functioning as well. Their hippocampus is smaller, so they have less memory to call upon. They have less what we would call executive functioning, understanding of cause and effect to call upon. All the while they have a really active amygdala that's telling them they're got to run for their life or get into survival mode. These things make life very difficult for a child. Very difficult to be successful in any degree in learning. And they also closely resemble a pretty common childhood disorder. That disorder is ADHD. So a lot of times, diagnosis of ADHD might actually be trauma disguised, right? The ADHD symptoms are how the trauma is manifesting itself because of the damage that the trauma has done to their brain. So, whenever I work with a kid who has a diagnosis of ADHD, one of the things I always do is look at the trauma history and see if they have one. Because it's not uncommon for somebody to be diagnosed with ADHD, and really it's not ADHD. What we're looking at is the effects of what trauma has done to their brain. And so what that really means is that we need to deal with trauma first. The symptoms are not the first consideration. Okay, so these are just hopefully some practical things. Okay, so what can you do? So these are things that I think that can be helpful as a parent, as an adult who loves a kid that's struggling, as a teacher, as really kind of any level of professional, especially like an introductory level professional. So some things to keep in mind. So try to understand the need that is being met by behavior. It doesn't mean you excuse the behavior. In fact, excusing the behavior can very often hurt the child. So what you want to really do is set up an environment and say, yeah, this behavior is not acceptable. I want to understand why you're doing it. I want to understand the need that's getting met. You usually can't ask the kid that question. They won't understand why they're doing it. So you really have to pay attention to them. You really have to talk to them. You really have to understand what's going on. And that can be very hard sometimes. But you want to understand the need that is getting met by the behavior. So for example, you have a kid that is peeing on the walls, for instance, of his foster parent. And so that's unacceptable. That's not okay. So what you do is you work on it. You find, okay, well, the need that's getting met is he's needing to feel like he has power. He doesn't feel like he has power. He's getting moved from home to home, and he's really feeling the only thing he has control over is urination. Okay, power. He needs to feel power. Okay, so what about ripping paper? That's a way to show power. Okay, so let's give him phone books. Give him a whole bunch of phone books, and then he can start ripping up phone books, right? And that's a way that he can show his power. And yes, that is based on a true case. Reframe the behavior once the need is understood. So again, you can reframe the behavior not as, oh, you're this horrible kid that urinates on walls and doesn't care about anybody, but instead, you're a scared kid who's, I mean, you may not call them a scared kid, they might not take that the right way, but you're reframing it. That this is a scared kid who is trying to express themselves and trying to rage against how they are, the world that they're feeling imprisoned by, that they feel like they have no power over. Right? And so what you're doing is you're understanding the behavior. Again, it's very important that the behavior is not excused. They still need to clean up the urine. They still need to apologize for it. Excusing the behavior usually just makes every problem worse. However, it's very important to understand why the behavior and put the behavior in context. You want to respond, not react. You want to think before speaking, right? A lot of times easier said than done. You want to respond slowly and walk away and take time if needed. And don't make excuses for bad behavior. You want to understand it, right? We talked about that. That's very, very important. A lot of people just make excuses, and that just causes more and more problems. And again, think about it, right? The problem, like the things that a 5-year-old can do, how exponentially worse are they when a 25-year-old does them? So excuses are not the path to go down. It's understanding is the path to go down. You want to, if you are working with somebody like personally, they're not a professional person, but they're personal, like your kid or your niece or your nephew or something. If success is not gained or trying different things doesn't help, you want to seek outside disinterested help. And one of the reasons you want to seek disinterested help is that if they're not personally invested in the life of the kid, in some instances that can be really, really helpful. They're not the one who changed their diapers. They're not the one who's going to cry about every boo-boo. So they're going to be able to see the kid a lot more objectively and offer if they have sound clinical education, a lot more of an objective clinical opinion that can be helpful and give them clinical treatment. And when maybe behaviors or something pop up with a child, they're going to be disinterested because the child's not going to be able to hold them emotionally hostage like the child could hold a parent or a loved one emotionally hostage. Because the professionally trained adult should just be able to be like, I'm recognizing your behavior for what it is. I'm not going to let you control me with your behaviors, and set those boundaries and such things. Play therapists or other professional counselors who work in nonverbal means are typically the most effective for children. Because again, we've talked a lot about nonverbal and verbal, right? The art therapy and how that taps into this nonverbal part of yourself. And a lot of you have talked about it affecting ways you didn't even think it would affect you. And bringing up things you didn't think you would bring up, and triggering things that you didn't think you would trigger. Because it's getting into this nonverbal world that as adults we don't typically spend a lot of time in. But that is still, that play and all those things that are nonverbal are still the first language of kids. So if they do need professional help, sending them to somebody who specializes in working with these nonverbal means is going to be most effective for them. Okay, and then here are some references too. And for those of you who are more interested in trauma and learning about how trauma affects the brain, physiologically and such, I would really, really recommend The Body Keeps the Score by Bessel van der Kolk. It's a very good book. It's got a lot of information, but you can read it just, one chapter at a time. You don't even have to read it in order if you don't want to. So I hope that this has taught you a little bit more about the brain and how the brain processes trauma and how that leads to some of the behavioral problems we see in children and what we can do about that.